Do you keep breaking out and you wonder, do I have acne or do I have rosacea? They're two of the most common facial rashes that we see in dermatology, and today I'm going to help you understand the difference between acne and rosacea, because if you're an adult with skin issues on your face, it's sometimes hard to tell the difference. But I'm a board-certified dermatologist that diagnoses these conditions in the clinic every single day. It's important for you to know the difference, because if you get it wrong and you pursue the wrong treatment, it might actually make your skin problems worse. If you're new to the channel, I'm Dr. Dustin, a board-certified dermatologist. I have my own practice in Idaho, but I also go out in my mobile clinic to provide free dermatology care to underserved populations, and that's why I make videos on social media, is to help to fuel that passion of mine. So thanks for watching this video, and I look forward to your questions and comments. First, let's jump into acne. It's the most common teenage skin disorder, and acne tends to concentrate around the hair follicles. One big difference between acne and rosacea is that acne can appear on more areas of the body than just the face, whereas rosacea is primarily located on the face. It concentrates around those hair follicles, and the most mild form of acne is called comedonal acne, and this is whiteheads and blackheads, which are closed comedones and then open comedones. To give you a little bit of technical jargon, it's not that important really. This is essentially when one of the pores is starting to fill up with oil and dead keratin, dead skin cells and material that fill up those skin cells. And when they're stuck underneath the skin, it looks like a little whitehead and there's not a lot of inflammation. You don't get comedones in rosacea. As that comedone gets a little bigger and it opens up to the surface of the skin, when air hits that oil, it turns dark, and voila, you've got a blackhead. The next type of acne is going to be inflammatory acne, and this is where you're going to get pustules on the skin and more redness. And this is where most people are not sure if they have acne or if they have rosacea, because these pustules, you can pop them, you get that junk out of there, that white pus, and that can happen in rosacea as well. You can get pustules, but they don't have to be concentrated around a hair follicle. Now, inflammatory acne can happen anywhere on the face. We see it all the time on the forehead, the cheeks, the nose, the chin. People get it down their neck, on their chest, on their back, their shoulders, sometimes even down onto their butt. I covered back knee, chest knee, butt knee, all of that on a recent podcast episode. If you want to check out my podcast, Skinfluence, it's on all major podcast players. The next phase of acne is going to be cystic acne, and these are deep cystic lesions that are often very painful, and they don't come to a head very easily. These can concentrate around the chin and the jawline, particularly in women, as hormonal acne, or they can happen anywhere on the face, and these are the patients in my clinic who would be potential candidates for Accutane. Now, to touch on the treatments of acne, when you are looking for over-the-counter options, we want to look for a cleanser that works well with your skin type. And if you have very dry skin, stick to a hydrating cleanser or an oil-based cleanser, because that's not going to overstrip your skin. If you have more normal skin, you're not too oily, you're not too dry, again, a hydrating cleanser or a light foaming cleanser might be okay, but you don't want something that is really going to strip away all those oils on your skin. If you have significant acne and you're pretty oily, a foaming cleanser is a great option for you. And you can even start to look into cleansers that have active ingredients like salicylic acid. We carry one in my clinic, and I'm going to have a link to that down in the video description for our glycolic and salicylic acid cleanser. Now, cleansing is one way to help treat your acne, especially if you have active ingredients in your cleanser, but those are not sitting on the skin for a long time, so you're probably going to want to look for products that stay on the skin overnight, or that you put on in the morning and wear throughout the day. At nighttime, my favorite product is a retinol, and there are a couple of retinols available over the counter, and that is Differin Gel, which is adapalene. This used to be prescription, and now it's available over the counter, which is great. And La Roche-Posay also makes an adapalene cream that you can purchase. In the morning time, this is where I like to use benzoyl peroxide. Benzoyl peroxide is going to get down into those pores, and it releases oxygen, and that kills the bacteria that cause acne. We call it comedolatic. Essentially what that means is it opens up those pores and helps stuff to come out of them more naturally. You can also get a leave-on salicylic acid product. So you can get up to a 2% salicylic acid that you put on the skin and leave it on. That can be used morning or night. The biggest word of caution is if you are using these products, they all can cause some dryness on the skin, so you probably don't want to use them at the same time. You want to separate them by using one in the morning and and one in the evening. And of course, the rule is if you're using these products over the counter and you're still getting acne, it's not resolving the way that you'd like it to, you should go see a board-certified dermatologist to get on more aggressive treatments. Particularly if you are at risk of scarring. If you're starting to notice big texture changes or lots of dark marks on your face, your back, chest, or shoulders from acne, you want to get in and stop that process from scarring, because those are going to be with you permanently. Now, the reason you have to know the difference between acne and rosacea is if you take retinol and benzoyl peroxide and salicylic acid and you start putting that on your skin, but you actually have rosacea, you could definitely make your skin problems worse, because rosacea is not necessarily a problem with the hair follicles. This is due to skin barrier disruption. That skin barrier you have that keeps water inside your body, keeps pathogens outside of the body, keeps your skin from being itchy and dry, it's just not working very well when you have rosacea. And there's significant inflammation in the skin. And if you start putting on these products that are going to dry you out more, your rosacea is probably going to flare. Let's talk a little bit more about the differences. When we're looking at rosacea, there's often more redness in the skin. We typically think of 3 types of rosacea, and that is type 1, 2, and 3. The first one, I'm going to give you a big name here. It's erythemotelangiectatic rosacea. And this is where you don't have pustules on the skin, you don't have things that look like pimples, but you just have a lot of extra redness in the skin. And whereas acne can appear anywhere on the face, this is usually concentrated on the cheeks and over the nose. This is not a butterfly rash of lupus or anything like that, but you get that background redness, and if you look closely, you may actually see new little blood vessels forming, particularly on the sides of the nose or out on the cheeks. When you have formed new blood vessels, the only way to get rid of those permanently is through laser treatments, which we can talk about a little bit later. The next type of rosacea is called papulopustular rosacea, and these patients often have a lot of background redness through the central part of their face, but they're also developing what look like pimples. They're just little pustules, and that's essentially just small pockets of inflammation where your body fills that up with white blood cells. One of the inflammatory processes that is going on here is when your skin barrier is disrupted, your skin is releasing chemicals to bring more of these white blood cells to the skin. And so it's trying to fix a problem, and it just leads to so much inflammation. When you have rosacea, you're also much more likely to feel sensitivity on the skin, where a cleanser that you use or any makeup or other skincare products that you put on are more likely to cause stinging, burning, and itching. So if you're feeling a lot of that, you may have rosacea and not acne. The third type of rosacea, thankfully, is not something we see commonly, but this is called phymatous rosacea, and the inflammation is so intense that people actually start to grow new tissue. The most common location is the nose, and we call this rhinophyma. If you are over 60, 70, you probably remember an actor called W.C. Fields, and he was classically known as somebody who enjoyed alcohol, and his nose just started to grow and get really big. You can see a picture of him here. Phymatous rosacea, although it most commonly affects the nose, can affect the earlobes, it can affect the forehead, and it can affect the chin, where you get more of this fibrous tissue that starts to develop, and this is something that has to be often corrected surgically. With these patients, I may use Accutane or low-dose antibiotics also to help control that inflammation. So you've seen some pictures of acne. We've talked about the 3 different types. You've seen some pictures of rosacea. We've talked about the 3 different types of rosacea, and we know that it's not good in rosacea to go using a lot of retinol or salicylic acid or benzoyl peroxide. So what are you going to use if you have rosacea? As I mentioned earlier, your skin barrier is damaged when you have rosacea, so we really want to focus on products that help to rebuild the skin barrier, and that means a very gentle cleanser. I would recommend staying away from foaming cleansers and cleansers that have a lot of active ingredients like glycolic acid, salicylic acid. You want something that is just going to remove the makeup at the end of the day, some sunscreen, dirt, oil, sweat, but not too much oil, obviously, because we want that skin barrier to be healthy. So I'm going to leave a link down for the CeraVe Hydrating Facial Cleanser or the Cream to Foam Cleanser cleanser, which are two of my favorites to recommend in rosacea. If you find that those don't work well with your skin, a couple other brands to consider would be Cetaphil or Vanicream. They're all very gentle and fragrance-free, meaning they're less likely to cause irritation on the skin. I also recommend that you have an excellent moisturizer if you're dealing with sensitive skin and rosacea. Two of my favorites are going to be Avène Cicaphate Cream and then La Roche-Posay Cicaplast Balm B5. These are thick moisturizers and they're easier to use at night than the daytime, but you want a generous amount on the skin to really help repair that skin barrier. I use these types of lotions and creams all of the time on my patients who I performed laser procedures on, and we're actually destroying their skin barrier during the laser treatment, and we're trying to repair it as quickly as possible. So I frequently will use these in the recovery days after a laser treatment, but I've also seen them work really well on patients who have rosacea, and we give out tons of samples anytime my patients have rosacea. Of course, I'm going to have a link to those down in the video description. If you have rosacea, it is important not to neglect sunscreen, because when you go outside and you're exposed to ultraviolet light, that will further lead to inflammation in your skin and will end up making the problem worse. But if you have a lot of redness, how do you want to approach that? I talked in a previous video about the Elta MD UV Skin Recovery Sunscreen. It is my favorite one to recommend for patients who have rosacea because it has many ingredients to help repair the skin barrier, but it also comes with a little bit of a green tint. And this is not enough of a green tint to make it look like the Wicked Witch in The Wizard of Oz, but it's enough to help mask that redness. As you know, the green and the red are on opposite sides of the color wheel and they kind of cancel each other out. So if you have background redness and you have a slight green tint in your morning sunscreen, they're really going to help neutralize and give you a more even skin tone appearance. Next, let's touch on some active ingredients that could be helpful if you have rosacea. Over the counter, you can purchase something called azelaic acid. The Ordinary has a 10% azelaic acid serum that's very good, and there's many brands now that include azelaic acid in different products, and I'll have links to those in the video description as well. Azelaic acid has anti-inflammatory properties because, again, we have all these chemical signals in the skin telling us to recruit more white blood cells, leading to more inflammation, leading to the development of extra blood vessels, and azelaic acid is one of those that you can get over the counter to help calm down that inflammation. You will also just see benefits from gentle cleansing and a really good moisturizer though. It's important to stay away from products that have a lot of added fragrance, dyes, or colors because those may increase your risk of allergic reactions when you have a broken skin barrier. In the clinic, we'll also use other topical medications. One of those will still be azelaic acid, but at a higher percentage than you can purchase over the counter. And then we'll also use things like metronidazole cream. Metronidazole is an antibiotic, but we don't use it very often in an oral form anymore. Topically, however, it can work really well for rosacea. Metro cream or Metro gel are common generic prescriptions that we will write in the clinic. And then there's something called ivermectin. Now, this is not the same as ivermectin that had a whole craze during COVID, but it's in a topical form and it has proven anti-inflammatory benefits when used on the skin. One other potential little trigger for rosacea are these mites that live on your skin called Demodex. Now, you have mites that live on your skin. I'm sorry to tell you that. Everybody does. I'm sure I do too. And these mites, if you have a broken skin barrier and an increased risk for rosacea, your immune system is going to react against the mites more. They live down in your hair follicles, and here's a picture of one just in case you were curious. It is gross to think about, but you've got mites living on your face, and they're pooping there, they're laying eggs. Ivermectin kills those mites, and that's going to help reduce inflammation by getting rid of something that might be triggering rosacea and also just calming the inflammation in and of itself. One of the most common things that we will do in the dermatology clinic is actually write for a prescription compounded medication that includes azelaic acid, ivermectin, and metronidazole all in the same cream. So we get 3 different products on the skin with one application. And although this is compounded, most of the time the prices are pretty reasonable because insurance companies don't cover compounded medications, unfortunately. If we're still struggling to control the inflammation for somebody that has rosacea, we may turn to a low-dose oral antibiotic like doxycycline at 40 or 50 milligrams a day. This is far below what we would use doxycycline doxycycline 4 to treat an active infection like a MRSA infection. At these low doses, it has great anti-inflammatory benefits to decrease the development of those new blood vessels, to help calm down inflammation for your skin barrier. And at those low doses, if you take them with a little bit of food, you're less likely to see disruption of your gut microbiome, because that is something that we don't talk about enough in dermatology, is that your gut is probably playing a huge role in rosacea and acne, and we want to be kind to the gut. If you have severe rhinophyma type rosacea, we might use low dose Accutane in the earlier stages, and in the later stages it might be something that can only be repaired through surgery. So we've covered both acne and rosacea, and if you're an adult who's starting to see pimples on the face and you have that background redness, hopefully you've got a little bit more clarity on which you might have and the over-the-counter options that you can treat it with. And if the over-the-counter options aren't getting you the results that you want, you know when to go see a dermatologist. So tell me, now that you've seen this video, do you think you have acne or do you think you have rosacea? And if you need any of those products, I will have them linked down in the video description. So I look forward to your comments, your questions, telling me which kind you guys think you have, and I'll see you guys on the next video.